Lower limb ischemia is a condition where blood flow to the lower extremities is reduced or completely blocked. The differential diagnosis involves identifying the underlying cause, which may be acute or chronic. Below is a structured approach. 1. Acute limb ischemia, ALI. This is a sudden onset of ischemia, typically requiring immediate intervention. Arterial embolism, common sources, atrial fibrillation, recent myocardial infarction, endocarditis, or aortic aneurysm. Presentation, sudden, severe pain, cold and pale limb, absent pulses. Arterial thrombosis often occurs in patients with pre-existing peripheral arterial disease. Presentation, less severe pain than embolism, prior symptoms of claudication. Trauma, arterial injury from fractures, dislocations, or penetrating trauma. Aortic dissection may cause ischemia by obstructing arterial flow. Associated symptoms, chest, back pain, pulse asymmetry. Iatrogenic causes, catheterization or arterial interventions leading to thrombus or dissection. Hypercoagulable states, e.g., malignancy, antiphospholipid syndrome, or inherited thrombophilias. 2. Chronic limb ischemia. This refers to long-standing reduced blood supply. Peripheral arterial disease, most common cause, often secondary to atherosclerosis. Symptoms, intermittent claudication, rest pain, ulceration, or gangrene. Buerger's disease, thromboangiitis obliterans, strongly associated with smoking. Typically affects young males, involves small and medium-sized vessels. Chronic embolism, recurrent small emboli from proximal sources like atrial fibrillation or prosthetic valves. Popliteal artery entrapment syndrome, common in younger individuals, often athletes. Intermittent claudication due to mechanical compression of the artery. Arteritis, e.g., Takayasu arteritis, giant cell arteritis, presents with systemic symptoms and pulse abnormalities. 3. Venous causes, phlegmasia cerulea dolens, severe form of deep vein thrombosis, DVT, leads to ischemia due to venous outflow obstruction and subsequent arterial compromise. May-Thurner syndrome, compression of the iliac vein predisposing to DVT. 4. Other causes, vasospasm, Raynaud's phenomenon. May mimic ischemia, but typically involves temporary episodes of pallor or cyanosis. Compartment syndrome, increased pressure within a closed compartment causing ischemia. Typically follows trauma, surgery, or prolonged immobilization. Cold exposure or frostbite, direct injury to vascular structures leading to ischemic changes. Approach to diagnosis, history, onset, duration, risk factors, e.g., smoking, diabetes, hyperlipidemia, prior vascular disease, trauma. Physical examination, assess pulses, skin changes, pallor, cyanosis, capillary refill, temperature. Imaging, Doppler ultrasound, first line for vascular assessment. CT or MR angiography, detailed evaluation of arterial and venous systems. Conventional angiography, gold standard for identifying blockages. Early differentiation between acute and chronic causes is crucial for appropriate management and to prevent limb loss.